let me welcome you. I'm Mike Merson. I'm the director of the Global Health Institute. I want to welcome our graduates, parents, families, friends, and faculty to our Master of Science in Global Health commencement ceremony. Of course, first and foremost, I want to congratulate our graduates for their many achievements during your time at Duke. It's a big day for you. It's finally happened. I want to recognize that people have come a long way. I didn't get a chance to see all of you, but I met people in the room from China, Ghana, India, Texas, Oklahoma, California, Minnesota, and good old Raleigh. So I'm sorry if I missed any of you, but welcome. You've come a long way to be on this very festive occasion. I also want to recognize our faculty and the Institute who've joined us today. I don't want to embarrass you, but could you just stand so people can see who you are? For those of you who are here, please stand just so you can see our faculty are here. Thank you. I have to say to to all of you, I noticed the students were clapping. So, more than 30 of our faculty in the Institute are really from across Duke, are instructors and mentors to our students. And without them and all they do for the students, their mentoring, they work hand in hand with the students, helping them with their thesis project. They provide leadership, teach courses. They're really vital to the success of this program. Our institute is one of 7 university-wide institutes at Duke. All of the university institutes at Duke are interdisciplinary. We're in our 7th year. We have many accomplishments to be proud of, and one of those is that we believe, and we try to be modest, that we have one of the most comprehensive portfolio of educational opportunities of any U.S. university, spanning from undergraduates to masters, doctoral and professional students to postdoctoral and medical fellows. This emphasis on education, we believe, puts Duke at the forefront of academic global health and positions us well to continue to be a leader in the future. Let me be really clear, though, that most of our success is due to the commitment that Duke University and the Medical Center and health system have made to us, to global health at Duke and to the Institute. One of the individuals we have to thank for this commitment is Victor Dzau, the Chancellor for Health Affairs at Duke University and President and CEO of Duke University Health Systems. Chancellor Dzau, Victor to me, has been a champion for global health from the first day he stepped foot at Duke. He's an important reason why I came to Duke 6 years ago and why we've been so successful. It's my honor that he's here today with us. It's a very busy day, but he came to be with us, and it's my honor to welcome him and invite him to say a few words to our graduates and families. Victor?
Well, good afternoon, and congratulations to the graduates, the master's degrees in global health. Before I start making my remarks, I do want to say that the success of this program clearly is related to the leadership of Mike Merson and Chris Woods and all the faculty who put so much time to make this work. It's also related to all of you who are passionate about what you do. You're here for one reason. And I know that you achieved that reason, and you have actually a tremendous opportunity to go forward with all the things you've learned to make a difference. So, you know, the Master of Science in Global Health program at Duke is, to me, one of the first programs of its kind in the country. And since it began 4 years ago, universities around the country have been copycats, right? They say we all have one, now that you have one at Duke. But I think that what we developed here at Duke is really different, and I think truly innovative. Our students study the concepts of research methodology, bioethics, policy, and health systems in the classroom, and then take the concepts and apply them on the real world. And that's what's really unique about this program. It is the field research experience that is so integral to this program, and I think that, and I know that, Mike and his team has made this available to you, and we're truly grateful. So we know where the action is. It is in the field where true innovation and solutions are found or have to be found. So if you think about the Global Health Institute here, as Dr. Merson said, you have successfully integrated yourself in many different ways throughout the Duke community. For example, actually we have graduate students working on the program. Actually, I started at Duke Medicine called the International Partnership for Innovative Healthcare Delivery, or IPHD. I'm sure you have worked with Krishna Yudapuma and also Richard Bartlett, but in fact, I work closely with them. So I can see that the students are working with so many different facets throughout the university. And they're assisting innovators across the world to scale up their innovations, to provide quality, accessible healthcare, and to help people around the world. This type of real-life experience not only prepares them for future careers, but also propels them in a path towards becoming real leaders and change makers. And that's what you are, and that's what you will be. I'd also like to recognize, as I said, the faculty across Duke who are committed to teaching and mentoring our students. When we imagined Global Health Institute 6 years ago, we would not have guessed that in such a short period, we have now 40 new global health faculty to Duke. And of course, kudos to leadership of Mike Merson. But so many people are coming here and working on this because we all care about the same thing. And I think that's what's really exciting about this initiative. It is those faculty who inspire the students, engage and challenge our students every day. And along with teaching, they're making significant contribution to research that you're also involved with. The research areas expand: cardiovascular disease, obesity, to emerging infections, cancer, and mental health. So I think our faculty and our students are making a real difference in the real world across the globe. So to our students, I'm so proud of all of you. You've contributed so much to Duke, but you also contributed to the world. And of course, you contribute to collectively to collegiality, teamwork, and also yourself. You help position Duke University as a leader in global health education in the United States and the world. And you are tomorrow's leaders. I have great expectations from you. And so remember, when you go forward with your journey started at Duke. Thank you very much.
So thank you so much, Chancellor Dzau, for your leadership and commitment to global health. I echo that. It all not started here, but remember, you at least passed through here. Many of you had passion when you came, and we hope we played a role in this. The tagline of our Master of Science in Global Health is really more or less what you just heard. Global health leaders start here. It's not just a slogan, though, for us, but it's a commitment that we have tried to make to our students every day. In the classroom, in the field, as alums, we strive to provide our students the best possible experience. And let me say to all the graduates, I hope we've exceeded your expectations. We've certainly tried. Let me say on a personal basis that I look forward to staying in touch with you and following your path. We do follow you on one of these social media sites that many of which exist today. I know you will go far, and I'm glad you chose us to be part of your journey. So thank you for coming, all of you, and I now want to introduce Chris Woods, who you heard about already. Chris has been the Director of Graduate Studies at the Duke Global Health Institute and has led our master's program since the very first class. And he's watched it grow, and I can tell you to the students, he thinks about you all the time. And has been concerned since the day you got here about your leaving today feeling fulfilled in your experience. I'm personally very grateful to him for his commitment to our students and to the Institute. So I'd like to turn over the program now to Chris.
Thank you, Dr. Merson, and special thanks to Dr. Dzau for joining us today. Gosh, and it is a beautiful day to celebrate, isn't it? So welcome, family and friends. We are celebrating 27 official MSc graduates from the 2012-13 academic year. I think only 19 of you are able to be here today. I'm presuming that the others are already off improving global health. Since our inception as one of the first global health graduate programs, as you have heard, in the country, to our recent selection of our 5th record-setting cohort, we have embarked together on an important and fulfilling journey to reduce global disparities around the world. Our graduates have rigorously prepared for that journey. We have taught them content and methods necessary to engage meaningfully in the important clinical, epidemiological, social behavioral, environmental, and policy-oriented research that will help guide us to a safer and healthier world. But it's they who brought the enthusiasm and energy necessary to carry it out. To harness that energy, the focal point of our program, as mentioned before, is the development of a research project in collaboration with a Duke faculty member as well as with an overseas mentor. This year's graduates conducted their fieldwork in 12 different countries on a diverse array of topics, ranging from the control of infectious diseases like influenza, HIV, TB, to defining the increasing burden of non-communicable diseases, including cancer and psychiatric illness. I can say with great sincerity how universally impressed I have been with the projects that our graduates of this class presented and submitted to the graduate school. Their success emanates from the efforts of our mentors and local collaborators, as well as from the infrastructure which has been established by our program staff. But most of all, it's from you, the students, and your passion and your commitment to your craft. As highlighted by Dr. Merson, we have an explicit mission here to develop global health leaders. As with other skills, leadership can be learned and it can be modeled. So we seek to expose our students to those great global health leaders who preceded us. So in my remarks to last year's graduating class, I highlighted the words of one of our great global health leaders, former CDC director and current Gates Foundation advisor, Dr. Bill Foege. In providing advice to a young public health professional, me, he urged focus on the important health problems of the day. Find that important problem and focus on that. Well, this year I'm going to highlight another global health leader, Dr. Joe Mamlin. Dr. Mamlin is a key collaborator of ours in Eldoret, Kenya, where he is founding director of the academic model providing access to healthcare, or AMPATH. Many of our graduates have actually gotten to work with AMPATH, and to hear from Joe when he visited campus for the annual AMPATH meeting, which was held at Duke just earlier this year. Dr. Mamlin inspires us by example. In his case, just being a doer, getting the job done. Now, Sarah Martin, our program coordinator, urged me to reprise an introductory blog I offered at the opening of this academic year. And so it goes like this. Until last summer, I had not been in Africa since 1998. At that time, deaths attributable to HIV seemed irrepressible. There was no antiretroviral therapy available. Life expectancy was falling, erasing decades of gains that had been made. There was little hope. I arrived in Kenya in August of just last year to a very different continent. The change was palpable from the moment I got off the plane. There was a buzz of life and energy. And instead of the rows of corrugated metal shacks that I remembered, leading from Jomo Kenyatta International Airport, there were now modern buildings. I had come with a suitcase-sized satellite phone that seemed novel in 1998, and it seemed quickly antiquated when I realized that everyone had a cell phone. Africa 2013 is a different continent to what I saw in 1998. New infections and HIV-associated deaths are falling. More people are living longer with HIV than we ever could have dreamed at that time. Antiretroviral therapy is increasingly available to our patients, largely due to the U.S. President's AIDS relief program known as PEPFAR and similar funding. And I realized that hope and not death was in the air. The next day, I actually met with Dr. Mamlin, at the Montsoriat Clinic, where he runs the largest PEPFAR-supported HIV treatment program on the continent, along with his Kenyan colleagues at Moi University in Eldoret. He's still very spry in his 70s, and Joe came to Eldoret to teach medicine, but heeding the words of Dr. Fahey, he identified the critical issue of the time, and he's now personally responsible for providing care to more than 20,000 HIV-infected Kenyans at 3 clinics throughout the region. And AMPATH, his program, covers over 150,000 HIV-infected lives. Through the AMPATH training program he created in 2001, Joe readily credits his clinical officers and the multidisciplinary staff for the success of the program and the lives they have saved. AMPATH Kenya now employs many of those treated in the clinic as counselors, administrators, and on the farms now supporting the program. So after hearing him describe his commitment with such passion, I told him, I just looked at him and I said, "I've got a new hero." He responded, "No heroes here, just people working." Well, working in global health is remarkably rewarding, but the work is also at times unspeakably difficult. Sometimes the challenges seem so enormous and insurmountable. We must remind ourselves that change can and is happening. Seeing Joe, his colleagues, and their work in Kenya reminded me why I got into the field in the first place. And as director of the Masters of Science here at DGHI, I have the opportunity to meet the next generation of global health leaders. They will make their life's work toiling away, trying to make the dreadful diseases like HIV as antiquated as my old satellite phone. And though I was impressed by Dr. Mamlin's humility, I do think he's a hero, and I think each of you should strive so high. So I did now want to take a few moments to recognize important people. Mike has already done some of that. I'm going to emphasize a few other members of our program. So first, to successfully navigate the Duke Graduate School and the Global Research Program, it's no simple logistic feat. Our students are remarkably resourceful, but I want to say a specific word of thanks to our tremendous staff, led by our coordinator, Sarah Martin, as well as her aides de camp, Lisa McKean, Michael Russell, and Brian Seavey. So if those of you, if Brian and Lisa can stand and wave so we can acknowledge you. Thank you so much for all you do. So as both Mike and Dr. Dzau mentioned, on behalf of the program leadership, I would like to recognize our outstanding faculty, many who are here in attendance, as you saw, and they have supported our students as teachers and advisors and mentors. In thesis committee service alone, actually Mike mentioned the 30 faculty members we have locally, but all told, we have over 60 faculty contributing to those committees, so it's an even larger number. You can get a great sense of the commitment to this graduating class. And I wanted to take a couple of moments to individually recognize some of our core faculty to guide our graduates through the new field of global health. We first developed an innovative curriculum that involved faculty from multiple departments and schools from across Duke. We teach the fundamentals of global health issues, but most importantly inculcate the core concepts of research methodology framed in global health questions. Well, Brian Pence helped institute that curriculum with our first class, and as my associate director, he just completed a curriculum review for our program. And we will begin to phase in those recommendations in the coming year. Importantly, he also led this year's selection effort for our incoming class, which thanks to faculty effort and really the representation of our student body here, we actually have a record-setting incoming class of 38 students. Well, he's also been a wonderful colleague and a dependable sounding board over the years. Well, he's off to great things down the street at UNC, and we look forward to working with him in the future. But I wanted to have you rise and let's recognize your great efforts, Brian. I did not see if Janine Reed, Janine, are you here? She's not here. Well, let me say a few words, because she's another one of our core faculty who helped develop the original curriculum. And through her multiple iterations of her research design course, she's been remarkably responsive to students and has really helped us test the best way to engage our very diverse student body that you've heard about. And she's tried different pedagogical techniques and different technologies, and she brings us fresh sociological perspective to the program. She's not leaving Duke, but she will be establishing a Duke presence in Doha, Qatar, and I hope she'll return to the program after her research year there, either to continue to teach or as a mentor, but I did want to recognize her contribution to the program as well.